You are doing well. Good afternoon, everyone. Welcome again. It's been a month since we last did this live screening. My name is Elikem Tamaklo. I'm the Managing Director for Nyaho Medical Center, and I'm pleased to be talking to you today about technology. And I have a number of people who will be joining me, who will be sharing their experiences around how technology and innovation fits in their day-to-day life, but also more importantly, what that means in healthcare. Now, I know all of us have gone through a significant storm being COVID-19, and the impact of COVID-19 on healthcare has been astronomical. We all know the challenges the healthcare system has faced. In the past, where you had to walk to a hospital or you had to go physically to meet someone, the challenges around an infectious disease like COVID-19 and the pandemic is that by going and meeting people physically, there is more risk associated with that. And so we saw a lot of the world moving and adopting different technology solutions, such as virtual healthcare solutions, telemedicine. We saw a lot of teams, a lot of people having virtual meetings. And this impact has shifted our attention and our focus on technology. Now, we use technology as a broad term, and I know that covers so much. We are in this new age, the fourth industrial revolution, where we're using data, we're using analytics, we're using artificial intelligence. And we hear of all these words, and it can get confusing. What does that practically mean for all of us as individuals, as patients? What does that mean for our healthcare infrastructure, our industries, our hospitals, and our clinics? And what does that mean for our doctors and the doctor-patient relationship? These are the things we'll be discussing today, and I'm pleased to welcome our first guest, Ehi Biniti. I've known Ehi for a few years now, and he is an amazing friend and partner. And I'd like to welcome Ehi into this forum.
Thanks, Elikem.
Fantastic. I'll get you to introduce yourself shortly, but I'd also like to then also introduce another person who's been working as part of the Nyaho team, and that is Kofi Ajeri. Kofi is the Technology and Innovations Director for Nyaho. Welcome, Kofi. How are you?
Doing excellently. Thanks, Elikem.
Fantastic. And we will be joined by one of our very own doctors, Dr. Dako, who is one of the upcoming, I think he's been not only a family physician, but also an upcoming health tech guru, and someone who's been playing around in this area. Dr. Dako, welcome. I think you're also in the room.
Hello, thank you so much. Thank you so much.
Fantastic. So I'm going to ask, just so that we can have a great conversation, please relax. This is an easy conversation, but please mute your mics when you're not on, because I'm going to be going to specific people. And the very first person is Ehi. Ehi, in 1 minute, please give us your background, your history. What have you done in this space called technology?
Thanks, Elikem. Thanks, happy to be here. 1 minute introduction. I've spent the last 20 years building and scaling technology companies across the world. I'm currently focused on the applications of artificial intelligence on a number of verticals, healthcare being one of the major ones, and looking to solve problems of scale around the world using technology. My past body of work includes work for my darling company I founded, Rancard, and a couple other companies, Google, Intel, Facebook, and a host of others around the world. But the focus has always been, how do we take innovation and technology and apply this to solving problems of scale?
And I think we'll definitely get into how we use technology to solve some of the significant challenges we have in our country, in our region. I'd also love for Kofi. I mean, Kofi, you've also done a number of things. Just briefly, what's your background, your professional background?
Right. So I've certainly done quite a few different things, a number of different industries, but all connected by the thread of technology, right? And in particular, what technology can do to lower barriers to access, right? So I was the first country manager for Uber in Ghana for its pivotal first couple of years, and what we did there was use technology to make access to reliable transportation, safe, reliable transportation, a reality for people in Accra and in Kumasi. Right, and I moved on from there to World Cover, where again, kind of a similar theme, but you could say I kind of went from high tech to low tech, and working with farmers across the continent in 5 countries, to access agric insurance, right, through mobile phones. And next, I'm here in Yahoo, obviously, to help build out, access to trusted healthcare by leveraging technology. So that generally has been the general, the thread. Leveraging technology to improve access to features which, improve people's lives.
I think it's also interesting because a lot of the areas you talked about access, and I think access is key. But I'd like to go to Dr. Darko for the first question. And I think, Dr. Darko, I know you're a medical doctor. You've been working for many years, and you're also training, you're specializing in family medicine, which is all about a holistic approach to the patient, not just one area. So, I mean, I'm curious, why are you interested in technology, and why do you think it matters? And what is this thing called technology, I mean, in the healthcare setting?
Okay, thank you so much, Dr. Tamaklo. So I am a family medicine resident training to provide comprehensive, continuous care to the general public so that patients have some continuity of care anytime they see a doctor who knows them so well and can better understand them. I've worked in other facilities where we were using the folder system. So a patient comes to you today, comes with a new folder, comes the next day, we can't find that folder, we need to get a new folder and all of that. So it really made healthcare and delivering care very, very difficult, not very continuous, not very comprehensive. So coming to Nyaho to see the electronic medical record, it was just excellent. It opened up my mind to the opportunities that we have in terms of technology and how we can better serve our patients. So since starting work here about 5 years ago, I've actually been very much interested in all the technological advances that we are making in trying to increase access to people, make healthcare a bit more convenient, a bit more comprehensive, and make it more timely to people so that at any point when the person needs a doctor, they can reach out by a platform to a doctor you can trust, a doctor you would want to see so that your care can be delivered to you at your home. And so when COVID hit significantly, I was part of the team that ran with our virtual care platform. And it was just excellent when the patients actually come in to see you and, oh, I know you. You've seen to me before. I am happy to see you. And the joy that they give to you makes you want to continue in that line, because during that time, it was just a bit more scary for elderly people, even for just a back pain. They are suffering so much at home. They are afraid to come to a hospital because of COVID. And just the mere fact that they could connect, get professional advice, get the care they need in the convenience of their home without being exposed unduly to COVID was touching. And so that really is the passion, and that's why I'm going forward in this technological space. Thank you so much.
Well, I mean, it's an interesting conversation around your experience. The doctor-patient relationship is one that is timeless, and we've talked about caring and trying to good communication and trying to empathize and giving how to help patients make decisions. So, I mean, I'm interested to hear from you. How does the future of healthcare look like? Dr. Darko, with everything that you've seen, yeah, I'm sure that around the world. There's even better things, and there's lots of interesting things happening, which are not yet in the mainstream. So what does the future of technology look like for you?
So yes, looking at technology in the healthcare space, it's really evolving fast. One of the classic examples is the electronic medical records, as I mentioned earlier, and that is helping us keep track of patients, helping you to better know the history of the patient, better plan for them as and when you see them. So that's a space that is really going to keep evolving and help us provide better care to our patients. Currently, there are medical schools that are training with virtual realities to allow medical students and doctors train by operating on patients on virtual corpses. Now that training with live dead bodies are almost going extinct, there are training opportunities that are coming through simulations and all, that the doctor doesn't have to kill a patient to learn. You can actually learn on a simulated environment and get better at what you do before you actually meet a patient that needs that care. So it's helping in training, it's helping in monitoring of patients. So there are all these tech gadgets that are coming up that can safely tell you your patient's heart rate, your patient's exercise steps, and all of that. So it is really helping us in monitoring. In diabetes, they are even doing a lot of insulin pumps and a lot of continuous measurement of blood glucose daily, even when you are exercising. And so that is equally some aspects that technology is going to help us with in terms of monitoring. It's equally helping us in surgery. So in most advanced countries, they are having surgery being done by robotics. So surgeries that take 10 hours, 20 hours, and obviously the human capacity has a limit, has a tolerance limit. But once you are using the robotics to actually do that, then your level of accuracy is improved, your tiredness and all of that is taken out, that bit of human element is taken out, and there is more precision in the care that we are delivering. There's a bit more in terms of diagnostics. So there's a lot of genome sequencing and DNA and all those big stuff that are going on. I think the more common one we are seeing now is using technology or artificial intelligence to sort of diagnose tuberculosis, diagnose some vertebral fractures and some other things on imaging. That obviously would improve access, would improve the timeliness of delivering healthcare, so that at night when a junior doctor or a less experienced doctor is on duty and they have access to some of these tools, they are able to make a decision quickly because the artificial intelligence tool has given them a red flag that they really need to act on. And so it's almost endless in healthcare as we see the evolution going.
Elikem, I think you might be muted.
I've fallen into the normal trap of Zoom and all of this online. I'm sure everyone who's listening can empathize. So Dr. Darko, thank you for sharing. I know that you highlighted a number of things, but I have two categories that I'm thinking of. You talked about one, improving safety. I think that's really where it was extremely key in the past, where people have gone into hospitals and their care has been compromised because of a mistake. You shared about some of the opportunities that technology helps in improving safety and preventing some of these very horrific and very upsetting mistakes that come from human error. And then on the other hand, you talk about precision, you talk about how do we find better solutions for patients so they can get healthier and they can get treated quickly. So I'd like to move to Ehi before I come to Kofi, because both of you have come from backgrounds which are not healthcare related. And so Ehi, the question around technology and specifically around artificial intelligence and data and analytics, because when I was listening to Dr. Darko, he mentioned a few terms. Is it just lots of fancy new toys? Do you think that these will really solve the problems? Because sometimes you hear of hospitals which have implemented all of these things. Let's take, for example, India currently has robotic surgery, has some of the most advanced technology, yet they're still crippled by the COVID-19 pandemic. So truly, is technology the answer? Eki, what do you think?
Thanks, Elikem, for that. And Dr. Darko's an extremely intriguing submission there. Well, so first of all, I'd like to say India's problems with COVID-19 have absolutely nothing to do with their technological advancement and everything to do with their political choices. So lest I jump into another discussion, I'd safely park that there and carry on. But I think technology, the fascinating thing about technology is its ability to democratize skill. Now think of it like this. The ability to train a doctor would traditionally could take up to 25 years, 30 years. And this if you put the full skill set from nursery, primary, university, first degree, practicing, etc. And along this journey, it's an expense. The country builds up this capability, etc. The doctor builds up a certain level of proficiency. You could literally train artificial intelligence to do a significant part of that job in 4 days. So the challenge you suddenly have is that the ability to multiply and apply and scale skill and learnings, not the intuition and the ability of the doctor, but the ability to take his key insights, his learning journey, the critical things learned, and put them in a manner which allows other people benefit from them, can be significantly shortened. So you can take a doctor who's of moderate skill and suddenly give him superpowers because there are tools to support him in his process, in his execution, his ability. So it's not just fancy words. It makes a dramatic difference in productivity, in safety, and in care. The second thing is the ability to take a closer look at how treatment happens. So treatment, in another way of looking at it, is a series of
So I think I'm not able to hear Eki. I'm not sure if we'll give it some time. Hopefully some of that will come and you'll come through. But maybe Kofi, whilst Eki is coming in, what about yourself? I mean, I think, do you agree in terms of, do you think that technology is a solution, or is it actually human choice?
I think it's not. I don't think it's an either or. Technology is definitely an enabler, right? And when we talk about some of the broader concepts like AI and machine learning and so on, it can be a little bit difficult for people to place into a practical context. But I can give a few examples of significant differences that AI is making, in the here and now. And Dr. Dalcom already mentioned them in his earlier submission, right? If you take the example of a radiologist, right, and imaging and reading those images to support a diagnosis or to help the doctor to make the right decision about what treatment plan to follow. You can take Ghana as a quick example, right? There simply aren't enough radiologists to go around, right? You can't station a radiologist or a number of radiologists at each healthcare center. And what that means is that people have to schedule to get a scan way ahead of time, which means that, the delivery of their care is delayed. Even when that scan has been done, it takes a number of hours, sometimes maybe even a day, for them to receive the results of that plan. And all during that time, care isn't being administered, the issue isn't being resolved. And there's an AI platform available today that at Yahoo we're in conversation with to explore a pilot, who provide a tool that will take a first glance, right, at the imaging that's been provided and be able to give an early report to the doctor that can be verified by a remote radiologist. And so you're talking about within the span of 15 minutes, being able to get feedback on a scan that you've done and quickly be able to get from the treatment plan compared to, the process that would have taken a few days. And that's AI at work, so it's not an academic or sort of a theoretical sort of application further down the line. It's happening today. And there are lots of different examples. Another example, for example, is with natural language processing, right? Some doctors would like, and the kind of the old joke about a doctor's handwriting being, unintelligible. Some doctors would prefer, for example, after seeing a patient, to record, that is to speak into a recorder to capture what happened during that encounter. When you use natural language processing, what some of those can actually do is transcribe the information that's being provided and then sort it into the right field and enter that information into an electronic medical record system. So the next person who's trying to get some information on how the encounter went with that doctor is actually able to review that information without having to listen to the recording. So it's very convenient for both parties, and that's, again, AI directly at work. So, you know, there are lots of other examples in medicine, you know, in drug discovery, for example, using, you know, AI to help with figuring out which new conditions existing medication can actually address, and also to help to discover which new medication will be necessary for existing conditions and can get, you know, that can get even better. So I'm very happy to hand over to Ehi at this point, but fairly confident that technology is playing an important and positive role in healthcare today.
Thanks, Kofi. Sorry, I think I lost the connection briefly. The pluses and minuses of technology. Yes, I think we do have we're in a very interesting time, and this has been accelerated by COVID. And so you have that these sorts of applications are now even more important because the healthcare infrastructure is really strained, and we need to be able to scale the skill and the expertise of a few talented people like Dr. Darko to regions far beyond his human ability can reach in one go. So I think for me, the first application is really the scale of skill. So you can take talented doctors and using AI, amplify their ability and reach to get to multiple markets. And that's the first. And then obviously other areas, how long it took to find a vaccine for coronavirus was a direct response of AI and its applications. So you suddenly had to take samples, run that through supercomputers, find patterns, and get your AI to predict new vaccines. And I think it's just a remarkable new set of tools which are here and now with us and actually changing productivity with which healthcare is delivered.
Absolutely. I think one of the things that I guess is useful to do now, we've kind of talked about sort of the high tech, right, and the possibilities with technology and so on. Something I'm keen to find out more. I have some reflections, but keen to find out your perspective as well as Ehi and as Dr. Darko and Elikem join us, is maybe to contrast, what the reality is on the ground, especially in some of our emerging markets, in terms of, what are people doing around healthcare and health apps today in the tech space?
Yeah, hello. Kofi, so yes, so many things are happening all around the world in the health technological space. In this, as I mentioned earlier, now we can actually do a colonoscopy with just a capsule. You swallow a capsule, it goes through your intestines and it's able to see and identify whether there are any specific lesions that are suspicious there. It can actually take some biopsies, take some samples of that lesion, help us send that to pathology and get some feedback on that. So I've had a patient, I requested a colonoscopy for, it took more than 8 months to get it done, just because it's a whole tube that has to go into the intestine, and it was just a nightmare for him. But then obviously, if we had such a solution available, yes, it would be just a little bit more expensive, but the convenience, the comfort that comes with it, obviously is unimaginable. And so I genuinely think that we need to embrace technology in our healthcare space, obviously with the involvement of healthcare personnel. So healthcare personnel should be involved in this whole process so that we're able to develop solutions that are more acceptable, solutions that are more friendly to them, solutions that are more effective in their hands, and not necessarily something we are just adding on to the arsenal, just increasing the load of options without necessarily adding on to benefit. And then in some countries, we're actually using some countries and places where specialists are almost non-existent. In India is another classic example. Some of the African countries have equally piloted that. You have a specialist in, let's say, Accra, and there's a chips compound in, let's say, some part of Ghana that is almost unreachable. But you and I know that our telephone networks and our internet access is actually moving very fast. And so if that person, that nurse or that midwife or that physician assistant in that place is able to communicate with a doctor or a specialist in another facility in the capital, probably by video, so that the specialist can see the labs, can see the patient, and make some quick inputs into what has to be done, then obviously we are improving access in that way as well. So there's so much to be done, and I really think as healthcare professionals, we really need to be able to leverage this and run with it. Again, as part of this this drive to improve the use of technology in our healthcare space, our national and public hospitals are actually rolling out EMR systems. So you go to most of these public settings, tertiary hospitals, and they are actually rolling out the EMR that helps them to keep track of patients. So you're able to see what the ophthalmologist did for your patient. You're able to see what the gastroenterologist did for your patient. Unlike times before where the person is carrying a new folder to every individual department, and that makes it almost not connected. And in terms of skill and training, so almost all medical schools now are including a component of ICT. Almost all medical schools are including a component of ICT. So even when I was training about 13, 14 years ago, we had a course on ICT, so that at least the basics of manipulating a computer, of doing some of the basic things using EMRs and all of that, you're picking it up as you go. If you are being trained with simulations and all of that, again, you're picking up some extra skill that will help you in this age as we go. And so I really think that, yes, the shift is happening just before our faces. It's actually happening. And as he mentioned, even in the development of the COVID vaccine, there was a significant use of technology in there to help us achieve that vaccine within this record time of a year. And so I agree that this is the way to go, and I would really expect that all my colleagues and people who are on board, people who get opportunity to at least get involved, will equally get involved.
Absolutely.
Thank you, Kofi. You can come in.
Absolutely. Thanks for thanks for the submission, Dr. Darko. I think it is very critical to highlight, what the practical steps are in order to get some of these, these very sort of blue chip, high and very fancy ideas into actual, improvements to healthcare delivery on the ground. So I was very happy to hear you talk about how, doctors now, and, even from when you were getting trained, are being brought up to speed on what the latest technology is and how they can apply it in the context that they go into. I think maybe one of the other things that will be helpful for us to do is to talk very broadly about what technology, when we fully leverage technology, right? The technology that we know about currently, when we fully leverage it, what healthcare delivery can look like in Ghana, just to give everybody who's on the call the full picture of what the patient journey will look like, and maybe to provide some context to that, right? We kind of have had up until this point a system where healthcare is done to you, right? It's not really something that patients are an active participant in. You feel something happen to you, but then you go to the hospital, so they tell you what to do. First of all, they tell you what has happened, and they tell you what to do. And then after that, you go back home, and you're not really an active participant in the delivery of your own healthcare. But I think, in future, it could be very different. I'm just keen to hear your thoughts on that. In a perfect world, right? If we continue on the trajectory that we are, with the EMRs happening, with the doctors getting their training, how what does the patient journey, what does that experience of healthcare look like?
So yes, thank you so much. So in this ideal world where obviously technology is very much available, everybody is able to use it in its perfect state. So the patient who is in his house, so my grandmother is at home now complaining of some significant abdominal pain with some vomiting, you know, the traditional setting, you are still a grandson. Nobody really sees you as a doctor. So you say whatever you want to say and it doesn't make sense. And they want to see a gastroenterologist or they have to see a senior consultant to sort of help them out. My grandmother is far away beyond in Sawam. So at this point, in the ideal world, I'll be able to click, get an appointment for her to do a virtual consultation. So this gastroenterologist, wherever he is, could equally connect. So the booking is seamless, the appointment is easy. My grandmother can have her consultation in her house. She doesn't necessarily have to know how to use it. She has grandchildren and sons and children for that. So they connect her, she sits down, and then the consultation actually happens. Beyond that, medication is delivered, prescriptions are sent in her home. So that is one of the ideal ways that is going to happen. You are going to get the healthcare at your doorstep when you need it, in whatever form you want. If the patient or the doctor thinks that, oh, you need to come in, do some tests and all of that, again, you can do all your bookings on your phone and then come to a facility, get your samples taken, and then you're gone. You don't necessarily have to queue like a traditional setting where you really have to queue at the reception, queue at the front desk, queue at medical records. Then you now go and queue at the doctor's gate, queue at the lab station. So many unnecessary roadblocks that obviously hinders access, hinders care delivery, and does not benefit anyone, because in the end, the doctor is frustrated, the patient is frustrated. And so you can get your care done in a way that you can control. You come in and after I have seen you, you have access to some parts of your notes because there's a patient portal, there's a connection for the patient to come into the system. So he or she can see, oh, what my suspicions are, what I am prescribing for them, and probably would have some extra information from a trusted source on whatever is going on with them. And so that really would help and make our healthcare very easy. You have to book for a surgery, you have to book for a different procedure, and it will come seamlessly because the whole thing is connected and makes it very, very easy for you to do. And so I think that in the ideal world, we are really going to enjoy the use of technology. We are going to enjoy the use of apps. We are going to enjoy the use of devices in different forms. And I think that would make our work extremely enjoyable. I think it will make our work extremely enjoyable because you see the results most immediately as you go, and a lot of things will make sense rather than me having to put in a prescription. Patient goes to a different place, there's no medication available, and then they go home, they don't get the medicine, and it doesn't help anybody. But if I put it in, pharmacy doesn't have, somehow the systems are connected, you're able to know that, oh yes, this particular pharmacy near your house has it, and then you're able to go there and get it. Even in our own use in the AMR model, you're able to see what medications are available in your pharmacy. So once you put in that medication, you are rest assured that your patient will have this drug in the next 10, 20, 30 minutes. And obviously that would help. So I am really looking forward to things getting better and we getting into some more ideal scenarios, because it explains why mobile money, for instance, has caught fire and is being used beyond traditional banking services. You can do it. I think it makes everything a bit more easier and more convenient for everybody. Thank you.
Talk a lot about, the improvement to the patient experience of healthcare, but doctors can only do so much if they aren't being given the appropriate tools, right? So there's systems you talked about which make it easier for you to enter and track information. There are systems that would make it easier for you to ensure the patient has end-to-end healthcare, right? Including making sure that if you're prescribing medication to the patient that is actually available in the pharmacy. You are recommending tests and can actually give the patient more information about where to go and find those tests and so on, and get those tests coming back to you in a format that is easy to pass. So it's so the challenge of figuring out what's going on isn't made harder by the tools that you're using. So I think it is excellent to for you to have mentioned that. I think that's a really tidy segue for us to talk about, okay, what does it take to make some of these technologies a reality, and pair that to what's currently happening on the ground. So what are the problems that have come up, and what are some of the solutions that are being developed to solve them? And I think, Ehi, this is maybe the perfect place for you to step in. I know your outfit is working on exactly working on exactly that kind of problem. So you want to come in? What's happening on the ground with healthcare app developers locally?
Well, I think on the ground at the moment, lots of healthcare app developers are working towards solving access to healthcare. So there's lots going on in the space around telehealth and virtual connections. I think, however, that the biggest challenge is the idea of connected healthcare. So in the past, healthcare used to be thought of as something that you went to hospital to do. But these days, healthcare is that your hospital comes to you wherever you are. So you can get care at home, you can get care at work, you can get care when you're in the hospital. But how do we make sure that the data from these episodes of care are connected? So lots of the work being done these days is around making sure that patients have access to doctors from wherever they are, and clinical staff and doctors have access to patients wherever they are, and making sure that the boundaries
Oh dear, I think we might have lost Ehi. I think maybe this actually speaks to supportive infrastructure, right? One of the things that we know is sort of an underlying layer that we take for granted to all of the healthcare tech that's being developed is internet access, right, and power. And while we're developing all of we're talking about what we can do to bridge the gap between some of these theoretical ideas and reality. Definitely one thing that has to be kept in mind is the context that we're in, right? So planning for that context, that is creating platforms that are forgiving. That is, if you're entering data into them and the internet should cut out, or your power should go out, that data should be automatically saved and so on. Platforms that are able to be used on multiple platforms. So if for any reason you have issues with your computer, you can just switch quickly to your phone or to your tablet. If you need to move around, you can kind of do that. I think some of those things are accommodations that local app developers should be keeping in mind as we build solutions. I'm going to take maybe a few of the questions actually that we're seeing come into the chat, because there are a number of them. And this one I think I should pose to Dr. Daphne. So the question that's coming in from Ejewa is, how do we train doctors in some of the rural areas? Dr. Daphne, do you want to come in to talk about what that experience is like? That is, when you're a doctor who's working in an area that's outside of an urban center, and what technology can do to address those challenges.
Almost all the training of doctors actually happen in a teaching hospital. And in a teaching hospital, usually those are big cities. So Kumasi, Accra, Tamale, Cape Coast. And these are places where you actually get the training to be a doctor. So usually in these places, you see patients, and now most of these places are actually incorporating the EMR. So you are being trained along that direction. So you are seeing patients, real life patients, making all your mistakes, and then learning how to use the EMR as you go. So that is usually how the training happens. So typically for a doctor who has moved, let's say, is working in a different, a very far away place where maybe he doesn't have colleagues, he doesn't have any seniors, he doesn't have a specialist, but you have a case that really needs a specialist input. Again, we're saying that there are telemedicine solutions. So in Yahoo, for instance, we have a telemedicine solution, and obviously over time when we scale up to other places outside Accra, for instance, our specialist and our consultant here can easily connect to that doctor in that outside Accra, in that rural setting, based on the internet connect. Yes, internet is a bit problematic, but we know that this is really moving quite faster than we think. Looking at the number of telephones and the number of smartphones we have in the country, and the amount of data that is being consumed here in Ghana. And so obviously within those places, it will be easier for a doctor, for a consultant here to see a patient by video and be able to make some input into the management of that patient without necessarily having to refer this patient all the way to Accra for almost everything. So there are patients that are referred to Kumasi and to Accra for very, very minute things. And you'll be amazed. Some of these challenges can easily be solved with technology. And so in terms of training doctors who are practicing in the rural areas, I don't think a lot is going into it. But let's say for my generation and after, we are much more tech savvy. And so it is much easier for us to connect. It is much easier for us to tap into the technological advantages or the technologies that are coming. And so in terms of training, yes, it's getting better, at least for people who are in medical school now. Even here in Ghana, most are having access to EMR, most are having access to simulations and all of that. So I'm quite hopeful. I'm really quite hopeful that would really help us as we go, and this will be beneficial for the doctors that are coming up.
That's an excellent submission, right? We do have to keep accessibility in mind. So regardless of where people are located, they can benefit from the improvements to healthcare tech. So keeping people in the rural areas in mind, I think, definitely something to do. There's another question that's come in, which has to do with cybersecurity, right? So Victoria Kujo is asking, with rising cybersecurity challenges, how secure are patients' data across such platforms? Very happy to take that myself, and also have Ehi also come in to weigh in. One of the things that I'm quite happy about, right, is that there's growing acceptance of global standards that all app developers are building to, right? So we already know, for example, the wave that GDPR caused, right? With all websites now being required to inform you when they're storing some data about you with your cookies and so on, for you to opt into that process, something that wasn't happening before. The thing that's happening in healthcare as well is that there's an organization, a global organization called HL7, that's developed some standards called FHIR, right? They're now on the 4th version of FHIR. And now if you're building any health apps or any health technology, this is the global standard to which everyone is building that, right? So there are some number one, there's greater consistency in terms of the way that information is being structured, right? So now, and even that in and of itself makes it easier for you to see if data is being stored the right way and so on. You at least know what the data is because they're structured in a similar way in the databases. And number two, there's a growing understanding that when you build a healthcare app, you are building it for a global audience, right? So you're not just building something for somebody in Ghana somewhere. They are going to need to integrate with lab software that comes from another vendor somewhere in the US. They are going to need to integrate with, maybe a temperature taking tool that's vendor somewhere in India or what have you. So all of those systems are sort of coming to a meeting place that is at a standard that's much higher than it would have been in any one country if we're keeping them separate. So it is quite a positive development in the space, and it means that cybersecurity standards now are much higher than they would have been otherwise. There is another comment from Nancy Perla Japon, right, who has mentioned that AI is doing well, and we definitely can't do without. So now there are some apps that come in very handy and are easily available if you need extra information in your line of duty, which might have previously looked, impossible and otherwise unreachable. I fully agree with that comment. One of the things that anybody who's visited Yahoo recently to get a COVID test would have realized is that since last year, right, we've had a platform available that allows you to see your test results when you're away from home, right? And that's a platform that's accessible on your phone, it's on your tablet, it's on your laptop or what have you. You're getting SMSs about it and so on. This is technology that wasn't available before the advent of COVID and wouldn't have been available if we didn't have some of the advancements that we're seeing these days. So there are apps which are making access to healthcare information accessible for both people within the healthcare setting, that is those who are providing the healthcare, and for the recipients of the care as well. Ehi, I'm very happy for you to come in if there was anything you were going to share as far as cybersecurity is concerned.
Well, I think you've pretty much hit it on the head. I think just a few more things to touch on that. There are global standards for managing all data now, and especially if that data is public. So there is all healthcare technology implementers are really supposed to be implementing these best practices. At least I know that for our organization and the organizations we work with, we take stringent efforts to make sure that we're compliant with the global standards, whether it's our GPDR or any of the or FHIR or any of the other global standards around privacy protection. This helps provide a consistent way, as Kofi has said, for managing patient data and controlling who has access to it and what level of access they have. So I think that they're global standards, this represents a certain amount of safety because there's standards in how this data has been managed.
Things that it's always important for us to consider is, sort of the national context, right? Because you always do need a collaboration between private entities and the public for us to see these improvements rolled out to the wider population. Very happy for Elikem maybe to come in here to talk a little bit about stakeholders and national policy and how that can support some of the innovations that we've seen in healthcare.
Well, I mean, actually was going to be passing, the good thing for me is when you have great people in the room, you allow them to talk. And actually the conversation has been interesting. And I think it's been one where a lot of the conversation around the challenges, in a sense, it always goes back to going to basics. Who is the primary user for anything that we're doing? And once we have clarity that the patient is the beneficiary of the healthcare, I mean, there's no healthcare without a patient. When we understand that the patient is the beneficiary, then all the systems have to work for that beneficiary, to the benefit of the patient. And so we have this interesting changing dynamic where, I mean, we've had a conversation around standards and globalization. And you start to see that the stakeholders in this technology space are multiple. You have governments who are invested in the success of any solution that touches on healthcare and patient safety. But you also have the hospitals, which have a governance responsibility. You have the individual, the doctors, the clinicians, the nurses, the pharmacists. And you also have those who are designing the solutions, the engineers, and all the software developers. All of these have to really ensure that whatever is happening is improving the healthcare outcome of patients. So from a policy perspective, I think this is a real challenge for governments because all the stakeholders are very diverse, have multiple interests. And the question becomes, how do you bring everyone to the table to start having a conversation about standards? But when you're looking at how quickly there's an evolution of technology solutions, you can't just have once a year meetings. You need to develop a system that really is able to take feedback and incorporate it. And that becomes something that we all have to invest and be part of. So I think that the conversation has been going round, and I think we have this interesting future ahead of us when we start to look at what technology will mean in a local context, but within a global economy and a global world. I'd like to, I'm looking at the time, and it's been a fascinating conversation. And I think that we have a few more questions I'd like to bring up. But the encouragement is, as we're coming to an end, I would like each of our speakers to start thinking of what do they feel is needed in our country, Ghana? What's the one step we need to all be taking? What do we need to be doing to move this conversation along? And so looking at the questions, I would like to sum up a few of the questions together so we can ensure we have a good closure. I've got Wilhelmina who's asking, what are the opportunities for local tech companies to help support healthcare facilities in Ghana? So Wilhelmina is asking that question. And I think that would be great to ask Ehi to come in and talk about what these opportunities are. So either Ehi or Kofi, I know Kofi, you also have had a lot of engagement in this area. If you can come in and share your thoughts, and then we'll move on to the next question quickly.
Yeah, absolutely, absolutely. So there are, you know, you can basically take your pick of opportunities, right? Because there are many. Some of them do have to do with healthcare. That is, you know, the actual interaction between the doctor and the patient, storing that information and what have you. And some of the opportunities also have to do with the surrounding infrastructure, right? And making sure that healthcare organizations can, you know, have modern modern hardware platforms to support the operation, right? To this point, and Dr. Daku talked about this much earlier in the during the chat. He talked about, you know, the transitioning from the horrors of a paper-based, you know, patient data management system to an EMR. But that's just one step of the process, right? Being the kind of healthcare organization, being a kind of technological organization that can provide, for example, training for nurses, right? Who are just, you know, maybe have come from an environment, maybe in training school and so on, where they weren't very familiar with tech and some of the new tech, maybe even Macs and what have you, different OSs, and providing some training for them, developing devices like we have in the US, right, that are built for a new imagination of healthcare, right, where you don't come and sit in front of the doctor, kind of like a student-teacher relationship. The doctor can sort of tells you what's going on, but developing apps which make it possible, like Ehi and his team have done, for the patient to participate in that healthcare conversation, right? So, and that's a very different thing from sort of the patient record system and so on. It's, you could call all of that part of, you know, the underlying infrastructure that makes it possible for healthcare to be delivered. The other platforms, for example, like corporate portal, right, which can make it easier for organizations which are providing healthcare access for their employees to be able to track that healthcare access. The way that it typically works right now is that this is outsourced to basically an insurance company. People go and they swipe and so on, and they can get that payment done, and that's fine, but it doesn't give the healthcare organizations themselves visibility into what's happening and into whether their healthcare solutions that they're paying for are actually providing full value for their employees. So you know, there are lots of opportunities in healthcare which don't necessarily have to do with creating something that a doctor himself will use. You have to think about all the different stakeholders who are involved. You know, the insurance companies who will be, you know, handling claims and so on. The corporates who are also providing access for their employees, the patients themselves to make sure they actually have access to that data. There are all of those kinds of employees and opportunities, and that doesn't even come to sort of the enterprise scale solutions like that I talked about, like, you know, nurse training and hardware and so on. So many opportunities in there, and we've only begun to scratch the surface.
That's completely true, Kofi, and I think you've touched on your very last comment. We've only scratched the surface. It's very true. I mean, I know that when COVID came, Yahoo as an organization was using Microsoft Teams and had adopted Microsoft Teams beforehand, but that acceleration was using it for just simple meetings. But we realized that, you know, there's a whole vast ecosystem of tools that help productivity for project management, for planning, for strategic planning, for thinking and getting your thoughts out. So I think it was a great way of highlighting how vast the ecosystem is. And we can't also forget about the fintech. You know, recently we're hearing of a number of fintech companies who are looking at going, you know, beyond the local country, are looking at building ecosystems around the African region. So when you think of the Africa Continental Free Trade Agreement, you start to see that you know, whatever we have in Ghana might actually be a solution in Nigeria. And in healthcare is just one industry that has a lot of opportunity. So I'd like Dr. Daku to answer the last question so that we can end this call. with our reflections. The last question is from Victoria, who is asking, how do we ensure we don't miss out on the human feel to care delivery? And I think that's such a key question, a great question as to the human touch. The technology is going to be doing all of these different things. So what is the doctor-patient relationship going to be? How do we have compassion?
So currently, training is evolving around patient-centered care. So most of the doctors that are being trained with that model of patient-centeredness, so that you are not just thinking about the diagnosis and what is wrong and just giving them something to go. So our reorientation in terms of training is actually happening, and that would play a key role as we go forward, so that the doctor, no matter how you are seeing the patient, whether it's virtually, whether it's in person, whether it's in the ward, or what, your focus is on the patient who has a problem and not on the disease or the diagnosis or whatever he or she has come in. So the patient will still feel safe, will still feel that humanness in the process, because our training is going towards that. And the access is in all levels. You could have in person, you cannot. But if I'm seeing a doctor I know, if I'm seeing a doctor I am comfortable with, then it doesn't matter whether I'm talking to them on the phone or I'm seeing them on video, and it will be easier to use the technological space. So we are just hoping and praying that with all the things that are going on, we'll be able to evolve in the right direction. But I think training has taken the headway in terms of patient-centeredness in care delivery.
Yeah, great comment. We have to learn, in a sense, it goes back to my first question, which is really around, with all the innovation and all the technology, at the end of the day, we are here as human beings to be solutions to help each other. And, especially in healthcare, any solution has got to help make that process easier and better. And so I'd like to just take the opportunity to thank you for all my panel guests who were sharing and answering the questions. It has been an interesting conversation. I think I wanted to make sure that there was a lot of time to unpack this, because we could have really had multiple days to discuss this topic. So it's quite a big one, but it's been expertly discussed, and I'd like to just ask each panelist to share what I mentioned before. What do you think is the one thing that you would like to leave the audience? One thing that we should be considering, one thing that we can be doing when it comes to this theme of healthcare. All of us are invested. So what should we be thinking about, especially in the era of this new technology age? So I'd like to start with Dr. Darko. What's your one message, very briefly, before we end?
So my final thought is that health workers should take a keen interest in the evolution of technology in our space, because burnout is now being closely associated with EMR use and all of that. But if health workers are deeply involved, then we are able to sort of get involved in the process and get a solution that we can use to deliver the care in a very good way. Thank you very much.
Thank you so much. And I've just had Eki Binati and Kofi Ajari, who've been speaking. They've shared a lot of their thoughts, and unfortunately can't be here with us right now. But I think for all of us who've been part of this discussion, it's very clear that what their message is that there's lots of opportunity, especially to solve the problems and to increase productivity. And listening to Dr. Darko, especially when we talk about burnout, the very best doctors, the very best nurses are still human. And especially when we look at the issue of harm or safety, human error is a very real thing. In the airline industry, whereby there used to be so much danger around flying, technology advances in all spheres has helped make that journey. There are so many thousands of flights, but has helped make it safe and very reliable. And also the experience, people's experience has also improved. So gone are the days where from the very first airplanes, there was a lot of wind and turbulence. But right now, the technology has helped in smoothing the journey. And so I think that we can take lessons from what's happening in the banking industry, what's happening in the aviation industry, what's happening in even the manufacturing. And we start to look at what is possible in healthcare, because all of us deserve good quality healthcare. Every one of us, from those in the rural areas to those who are in the cities, we need to create equity when it comes to healthcare. Every human being deserves an opportunity to make something of their lives. And just because they fall sick should not mean that just based on where they were, that determines whether they live or die. I think that is where we can leverage technology solutions to solving these very real problems. For all of you who've joined me today and just listening, I mean, I enjoy listening to people like Ahi, Kofi, and Dr. Dako because they have a lot to share. And I think we'll continue to have a monthly conversation on a variety of topics, but this is definitely one that we have to revisit and come again, maybe looking at specific solutions, which we can actually explore in deeper depth. Thank you very much for your time. Have a great weekend, and wishing you the very best of health as we end this call. Thank you very much, and have a great evening. Bye-bye.